Tell us something about your background, your work experience, and how and why you decided to join MBA after 14 long years of work experience.
So, as you mentioned, I'm a healthcare professional. I was working in a clinical research organization where I was involved in pharmaceutical drug development and healthcare analytics. So this was something which was an opportunity which I got when I was doing my internship. It was during my period of internship that I was made aware of an opportunity in a clinical research organization which was then known as Quintiles. Uh, and I went for the interview. It was an interesting interview where it involved evaluation in which they checked how if I can analyze an ECG, an electrocardiogram, and interpret what is the give the diagnosis. And along with that, there were many other questions about medicine in general and about my understanding of the pharmaceutical field. I was selected, and for a brief period, I was working as a cardiology associate over there. And then I transitioned further within the multiple departments over there, and finally, I became a part of the research and report writing team over there. It was a very interesting business unit in which I was working. It was called the Cardiac Safety and Connected Devices Business Group. It was also thoroughly scientifically grounded, without any of the human elements which were commonly there when you are undergoing a medical education. But having said that, that helped me look at it in a way where I could look at all the other aspects that are influencing the field of medicine. And some of them was the way financial considerations, geographic considerations, macroeconomic factors, microeconomic factors were influencing the field of medicine. That was quite interesting for me. But having said that, I was always working out on research studies which were aimed at improving the business processes within that organization where I was working in. And these were ones which the organization was encouraging me to present at various scientific forums. And we also worked on certain compelling research studies which were dealing with populations like with Parkinson's disease, with diabetes patients, with oncology, with cancer patients for oncology considerations and all those things. It was quite interesting in that way. So in that 14 years, I learned the wealth of experience that I acquired was quite compelling for me. I value it. I still value it. But having said that, I realized that I was getting a form of knowledge which was quite insular in nature, in the sense that it had its own conversation in the field of medicine, but it was not engaging as much with the other aspects that are influencing medicine. And I realized that if I need to grow further as an individual, I would need to get some formal grounding in those aspects of the business of medicine as well. And that's what made me consider getting a formal education in business administration. And that was the reason I decided to pursue an MBA program which would give me a sound footage and get back to the field of healthcare and medicine that I love so much.